Treating a hypothermic patient is relatively straightforward and a fair amount of common sense. If they're in a cold environment, we need to get them out of the cold environment. So move them from a cold environment to a warm environment. And this may be the back of the ambulance where you have the heat turned up all the way. It may be inside of a house or some sort of a warming shelter. As we're doing this, we want to be very gentle with the patient, especially if they're in that moderate or severe or profound hypothermia, because they're much more susceptible to going into ventricular fibrillation. Now, if the patient does go into cardiac arrest, do CPR as normal, ventilate them as normal, still stay with the ratio of compressions and ventilations, and use the AED as soon as it's available. And we can defibrillate every 2 minutes. So use your AED just as you would with a normal cardiac arrest. Now, if they don't go into cardiac arrest, again, move them to a warm environment. If they have any wet clothing, that needs to be removed, and then we're going to replace it with warm clothing or blankets and towels and sheets and all these things that we consider to be sort of passive rewarming. And passive rewarming just means we're trying to prevent more heat loss. Now, we can do some active rewarming, and that's going to be applying things like heat packs, the hot or warm ambulance, if you have hot water bottles. There's not a whole lot that we can do pre-hospitally for active rewarming other than keeping the ambulance warm and maybe some heat packs. We don't carry a whole lot of other type of heating tools. We don't normally carry heating blankets or heating lamps in the back of the ambulance. Don't let the patient eat or drink anything that might be a stimulant or an alcohol. Now, if they are able to drink some warm liquids, some hot chocolate or warm teas without much caffeine, something like that would be acceptable. In addition, we want to provide oxygenation for the patient, treat any injuries the patient may have. One thing about oxygenation, realize that your pulse ox probably isn't going to work well with them because their extremities are so cold. We've kind of shunted the blood to the core, and they may not have good reading for their pulse oxes. But in general, somebody that's hypothermic doesn't need a whole lot of extra oxygen anyways. But if you can get a pulse ox reading, try to maintain that oxygen saturation of 94 to 99. And you want to avoid the temptation to rub the hands, feet, or legs. This can actually move some of the cold, sort of stagnant blood up into the core and can actually make the hypothermia a little bit worse, or may dislodge some clots and things and cause problems with that. So we don't want to rub the arms or legs. So in general, move them from a cold environment to a warm environment, replace any wet clothing with dry clothing, handle them gently, provide oxygen and treat injuries as needed, cover them up with as much blanket and warm clothing as you can. Keep your ambulance warm. If you have heat packs, you can use that to help actively rewarm the patient and then transport them to the hospital. Frostbite is when the water inside the cells actually freeze, so our cells are frozen, and the skin typically will look very pale, maybe even white, kind of what they call a waxy look to it. And if you touch it, it may feel very stiff because it's frozen, so it may be very hard or just very stiff. And we treat this just a little bit differently. We just need to be more careful with it and protect it. Now, all the other things for hypothermia are still true. Keep them warm, move them to a warm environment, replace wet clothing. But the actual frostbite part itself, we just want to cover with a bandage or towel to keep it from becoming any worse. Trying to keep it as warm as you can. And then also just protect it from being bumped and things like that. And we don't typically actively thaw parts in the field. If you have to do it, you can do it usually with warm water, and we're looking somewhere around 100 to 105 degrees Fahrenheit. So think about like hot tub type water, and that water may have to be changed out periodically as it cools off. But generally, we do not want to thaw frozen parts. The reason we don't want to do that is if we thaw something and then it very soon thereafter refreezes, the ice crystals can actually be made a little bit larger and a little bit more jagged, so you can cause some more tissue damage by doing that. We never want to rub a frozen part. I know it's kind of tempting. A lot of times we rub our hands to warm them up, but we don't want to do that to a frozen part because all those ice crystals are fairly sharp and you can destroy the cell membranes and kill the tissue. So don't rub any frozen parts. Just again, keep the patient warm, take them to the hospital, provide all the medical care needed, and let them rewarm them at the hospital.